Hello, my name is Dr. Rajiv Lochan. I am the lead hepatobiliary and liver transplant surgeon at Aster RV Hospital, and I work with a large group of liver doctors, and we call ourselves the Integrated Liver Care Group. One of the frequent questions which patients ask me when they come to see me when they're being worked up for a liver transplant is, Doctor, where do we get a liver from? I think this is quite understandable. However, we need to, think about what the liver is and how and where from such a liver can be obtained. The human body is such a complex ecosystem, and certainly the organ from some other living organism might not be suitable for humans, although the view on this is changing, and there is a field which is called xenotransplantation, and wherein animal organs are being thought to be suitable for humans, and there's a lot of research going on, but that is going to take at least a couple decades to come to fruition. So at the minute, we are only left with the option of human livers. Now, the liver being a wonderful organ, it can regenerate when it's damaged. So even when you operate on the liver and remove a part of it, the liver tends to grow back. So this has led to the development of living donor liver transplantation. But before I go there, I want to talk about deceased donor liver transplant, which is organs which are donated by the loved ones of a family of a person who is brain dead. What does brain death mean? Brain death is when the brain of a person is irreversibly injured, but all the other organs are kept in inverted commas, not alive, viable. I just want to make this very important difference. The patient is dead, the brain is damaged completely beyond repair, and death has been diagnosed in this person, but the other organs are viable because the patient's circulatory system is kept going by a ventilator and by life support means. So this person's family, either because the donor during his or her life had expressed a wish to save others, or the family themselves think of this as a noble gesture, which it truly is. A person who is brain dead can actually give life to close to 8 to 10 people, depending upon the number of organs which are transplanted, decide to donate the organs to other people. So this donation and distribution of organs is very strictly controlled by law and by statutory mechanism. There is a Human Organ Transplant Act, and in Karnataka we have the Jivasarthakate, which is the state authorized body, and there is a similar body in all other states as well, which regulates the distribution of these organs and it ensures that the organs are used appropriately. So this is where a brain dead person can donate a liver. This liver is generally transplanted to one person, but on occasion we have actually split the liver and we have transplanted them to more than one person. We have done this about 3 times over the past 4 years, and this is called a split liver transplant, and this generally helps young babies or young children get a small portion of the liver, where the bigger portion is transplanted to an adult. However, you would appreciate that even though the number of donations are increasing, there is not enough donated organs to go around, because there is a vast number of patients on the waiting list. And this is where what we talked about previously as a living liver donor comes into play. A close family member, which is usually a first degree relative, comes forward, and is generally, we prefer donors to be between 18 to 45, 50 years of age, although on occasion we have pushed the boundary up to 55. The donors have to be really fit and healthy. They should not, most importantly, have diabetes or some other type of illness which will affect the liver, and they themselves should be of sound mind to understand the benefits of a liver transplant and also the risks of a transplant in donors. So a donor surgery is quite a big operation, and they will be not able to go back to regular work for 6 to 8 weeks. But generally speaking, the vast majority of donors do well, and they do not have any long-lasting health effects apart from the fact that they would have a scar on the tummy, and that scar would never go away. Even although we are now trying to do minimally, use the robot or the laparoscope to try and reduce the size of the scar. But for most donors, there would be a large cut on the tummy up and down, generally around about 10 to 12 centimeters in length, and this scar would never go away. The liver, because it grows, the liver size goes back to normal and the liver function tends to become normal within around about 4 to 6 weeks. And this form of liver donation does come into play when patients are very ill and they really cannot wait for a brain dead organ to be allocated through Jivasarthakate.